Hello, my friends. This is a talk about how neurosurgery evolved. So, neurosurgery, the central weave of neurosurgery, is the Halsteadian technique. And this Halsteadian technique was the great work of William Stewart Halstead. And these two books, Genius on the Edge and Cancer, Cocaine, and Courage, are the sources from which I sort of gleaned that he is central to the development of modern neurosurgery. He is central to the development of the Cushing's technique, and this was presented by me at the Neurological Society of India conference at Kolkata in 2024. If you look at this lovely work, The Butchering Art, and you really see how the modern surgery developed from the concept of the infection which was brought out by Dr. Oliver Wendell Holmes. And in 1840, it was a very filthy business fraught with hidden dangers. And you had a lot of people who were talking about the excessive mortality and morbidity after surgical procedures. Everywhere, as Ignaz Semmelweis, my hero, says, questions arose, everything remained without explanation, all was doubt and difficulty, only the great number of the dead was an undoubted reality. This is the famous Liston. He was a brilliant surgeon, a very brilliant surgeon. And he used to keep on saying, "Time me, gentlemen, time me." And this was also due to the fact that there was not much anesthesia, and surgeons, especially the brilliant surgeons, were known to be very, very fast. Sadly, this brilliant surgeon is remembered for this rare situation where 3 people died directly or indirectly related to his surgical process. Now, Liston's students, James Simpson, would go on to be a pioneer of chloroform use as an anesthetist. Really surprising that the brilliant Liston and another student of him, Joseph Lister, pioneered the aseptic technique. Thereby, the work of Robert Liston in influencing this should be really noted, rather than that one unfortunate accidental event. So this lovely book by Gerald Imber addresses how Halstead made this butcher shop surgery of his predecessors into the efficient, precise, directed, outcome-based, safe Halsteadian surgery of today. This period, in 1874, he studied at Yale, Columbia in 1877. And he combining and selecting the best suggestions offered by the most advanced operators and adding many new and important details of his own, Halstead, the first professor and surgeon-in-chief in 1893 at the Johns Hopkins, created a powerful new technique. This was, bought by a lot of his teachers like Henry Burton Sands, John Call Dalton, And these mentors initially, framed him and got him interested into the art of surgery. So he was an intern at the Bellevue Hospital, then a house surgeon between 1877 and 1888, and then he traveled to Europe for 2 years, visiting famous surgeons at Vienna, Leipzig, and Würzburg, and returned to the New York hospital in 1881. So now you can see that the huge number of surgeons who sort of influenced him. The list is long, and this lovely paper, Matas and Hewer, discussed the influence of Halstead's early European travel on his professional career based on their personal conversation with Halstead. And George Hewer was a remarkable neurosurgeon indeed. And as you can see, nearly every one of the German school of surgery influenced him. But the most important influence was that of the great Coker. And Coker and William Halstead had a beautiful friendship, and he was tremendously influenced by another German Neuber, a German surgeon who embraced Lister technique, sterilized instruments, and operative field, was the first to require sterile gowns and caps. And this you can see in McCallum's that all these things he picked up and brought back to him. In 1897, Jan Mikulis, a Polish-Austrian surgeon, was the first to use a surgical mask, and also was a pioneer of using gloves during surgery. So you have another study by Crow of Halstead of Johns Hopkins, and this he himself says that I realize that I owe chiefly to Germany such success that I have in my professional life. And this German genius was really, as in 1876, where Lister gave a talk to the International Medical Congress at Philadelphia. So you have these surgeons like the letters of Halstead and William Keene, who was another early neurosurgeon from the United States. So antisepsis for me changed surgery from purgatory to paradise. That was the remarkable comment made by Keene. So in 1876, Lister traveled to the United States to present his ideas and impressed Dr. Halstead with his findings. And in 1884, Halstead returned to New York City after studying in Germany and refused to perform surgery in the old theatre at Bellevue. Instead, he built a tent on the grounds that featured a gas stove to boil instruments. Halstead was sold on Halsteadian techniques. He became New York's most successful surgeon, fast, innovative, and bold. As his heritage constantly resulted in many publications, he fought a great personal battle and went on, because he became addicted to cocaine while researching regional anesthesia. He won and went on to father Modern Safe Surgery with Halsteadian Technique. Even look at this lovely thing by Wilder Penfield, who was my teacher's teacher, Dr. Ramurthy's teacher. The man and his problems as described in the secret records of William Osler. And it is a real remarkable thing that despite all this, he continued not only to be a bold, rapid surgeon, but also he was so methodical, meticulous, slow, and he really evolved from that initial young boldness to this. I have a new experience. I have seen half of the incision heal before the lower half was closed, and this comment was made by Charles Mayo, but he perhaps missed the point that this is what was inherited by Cushing, because Cushing also was ridiculed, but the surgery of the nervous system probably was absolutely essential, that it had to be a very deliberate surgery and there was no error for any mistake. He also brought back experimental surgery from Germany, got physiology and pathology to inform surgery and help innovate surgical techniques. It was this four at the Johns Hopkins who launched neurosurgery, orthopedic surgery, ENT surgery, urology, and obviously radiology. He began work in Welch lab, where he determined the submucosa as a crucial area for wound strength, capable of holding sutures in the intestine. The discovery established the basis of gastrointestinal surgery, providing a structural basis for sutured anastomosis. On that basis alone, Halstead can be considered the father of surgery on the alimentary tract, but that was not all what he did. He kept on writing, publishing on radical cure of hernia, subcutaneous closure in layers, and his greatest contribution was to transfer the technique of Coker. He also was responsible for finding a position with Coker or Cushing to spend time with him and do research and again bring back the second line of German tradition back to America. So he also, he discovered the nerve blocks. That was again his technique, and this paper discusses, that Rudolf Matas and Halstead had a remarkable association. Halstead lady wife was the dignified. She came from a very high family, well-to-do family, and because she developed dermatitis due to mercury chloride antisepsis, Halstead got the Goodyear Rubber Company to make thin rubber gloves for her to wear during surgeries. She was the head nurse of the surgical department. And the operating in gloves was an evolution rather than an inspiration thought. Other people had also used it, but Halstead brought it to really fore. It is remarkable that during the thing I wore them occasionally. We could have been so blind not to have perceived the necessity of wearing them invariably of the operation table, and this was very, very important. His infection rate was 9% after the introduction of sterile gloves, and later it dropped to less than half of 1%. Joseph Bloodgood made this point very, very clear, where he showed that the Halstead's method and techniques were really outstanding. And although he was a very reluctant surgeon, and as he became, but he had already reported 1,000 operations using cocaine, including trigeminal neuralgia. You have to read that the entire legacy of modern surgery is from this careful handling of tissues, which was pioneered by Halstead. He also pioneered this deliberate approach to operative surgery based on laboratory research and all tissue handling, everything. He did that. He was constantly ahead of his peers by keeping up with this. So every surgeon, more so neurosurgeons, have been trained in the Halsteadian technique and principles. Scrub suits, sterile gloves, they originated from the theatre of William Stewart Halstead, and now comes his biggest honor. He is the father of safe surgery, not the father of spectacular surgery, but the father of safe surgery. And his technique really went on to influence. This is him operating, and he went on to influence. As you can see, the young Harvey Cushing is standing here, and all of them were giants in their field. This Halsteadian technique can be described as the central weave of backbone of neurosurgery. William Stewart Halstead also both mentored both Harvey Cushing and Walter.E. Dandy and transmitted his thing. He actually is the real creator of the super speciality of neurosurgery via careful anatomical knowledge, research based, and tissue, respecting tissue, and a very deliberate, safe surgery which led to neurosurgery. So again, gentle tissue handling, scrupulous hemostasis, tension-free closures, crush-free dissection, strict application of surgical anatomical knowledge, accurate tissue plane restoration, obliteration of dead space, preserving vascularity and abscess are the core principles of the Halsteadian and later Harvey Cushing's techniques, which went on to it. And then we have to pay a real tribute to the German genius, which allowed for the residency system. Actually, the residency program was begun by Langenbeck in Germany, and his clear crystal thinking, decisive, unemotional, living by the rules, careful antisepsis, meticulous hemostasis, gentle tissue handling, attention to physiology, slow methodical surgery. He would never operate without studying the anatomy, studying the patient. He would plan the operation, and thus he has to be respected as the father of modern surgery and father of safe surgery. At every step of the operation, extraordinary care and time-consuming care was the key. He established the world's first school of safe, scientific and anatomically correct surgery, and also he created the near perfect working environment that shaped the education of generations of surgeons. He, despite the high things, so he was a very critical teacher, but he was always supportive of Cushing, and who for 14 years had a very complex relationship with him. But I'm sure if he had to live his life again, he would have asked for only Halstead as his teacher. So he has written this lovely paper in 1904 on the training of neurosurgeon. We need a system, and we shall surely have it, which will produce not only surgeons but surgeons of the highest type of men who will stimulate first youth of our country to study surgery and to devote their energies and their lives to raising the standards of surgical science. So this surgical teaching, as started by Langenbeck, was taken to new heights by Halstead, and he has been a father of this graduated responsibility surgery, of having a junior assistant and then becoming a resident, assistant resident, and finally a trainee, finally referred to as the resident, second only to Halstead, who stood at the apex. As trainee advanced, they would adopt increasing responsibility. Not every training started as junior resident. Promotion was not assured. Not all assistant residents advanced to the top post. Halstead selected only the best candidates for his residency, and most importantly, only the best would finish. So now, as we can see from this presentation, that he was the central weave. So among the 17 residents he trained, 11 went on to become professors of surgery in their new posts, setting up similar residency program. These 11 produced 166 resident surgeons, 85 became teachers in university, and together the first two generations of Halstead's tradition trained 238 surgeons. Among them were 139 surgeons in full-time teaching positions in the United States. And so, as you see, this Kim elaborates how the entire surgical excellence which has been established by him continues to go on to the rest of the world. Like Gerald Imber says, that virtually all professors of surgery through the end of 20th century in America could trace their academic lineage to Halstead. He is without any question the father of global modern surgery, and not only the thing. So now it was Geoffrey Jefferson, Hugh Cranes, Norman Dott who carried the Halsteadian technique to Britain, and thereby Oliver Crona to Europe. And as Penfield remarks in his biography, no man alone, being a distant pupil of Cushing and Dandy, I would always be the pupil of my first professor of surgery, William Halstead of Johns Hopkins. So we all neurosurgeons owe a great debt to this giant, and I wish all young neurosurgeons aspiring should remember him and emulate his brilliance in safe surgery and knowledge of surgery. Thank you once again for your patient attention.